A good evening to everyone. Good evening, everyone. We shall just be waiting for a few people to join us, and we shall be starting this memorial in a few minutes. And let's just give our friends a few more minutes to join us, and then in 2 to 3 minutes, we shall start. Thank you very much. Good evening, everyone. Thank you very much for connecting to our memorial. I apologize. Okay. My name is Atori Elizabeth, and I will be your host for tonight. I welcome every
Sorry, I think I may be the only one. I can't hear this. Is everyone able to hear?
Can you hear me? I hope everyone is able to hear me now. Can you hear me?
Yes,
if you are able to hear me, just type on the chat and I'll be able to. Oh, great. Thank you very much, Moses. So I want to welcome you all. Thank you very much for connecting and for registering and for giving up your time to come and share collectively with all of us. I know it has been a difficult, intense time for most of us here. Every single person here has known a friend, a father, a sister, a child, really a beloved that has gone to as a result of this current pandemic. And we are all in our own ways trying to grieve and figure out how to move forward. I welcome every single person. We have so many people that reached out and decided to share their story, so many people that decided to write something, just to eulogize someone who to them that is beloved and that is no longer able to be with us currently. We are going to just start our. I just want to invite at this juncture Ms. Salima Namsovyang to give the opening remarks. Ms. Salima, you're welcome. Yes, we see you, Salima.
Thank you, Elizabeth. Good evening, everyone. I want to join Elizabeth in welcoming everybody to this memorial. We are here in honor of over 1,000 loved ones who have so far died from COVID-19. We would have liked to have this as a physical meeting, but this is not possible, as you all know, because of the restrictions. But also for many of us, it is in a genuine attempt at protecting ourselves from catching COVID-19, because as we all know at this time, the chances of one dying from COVID-19 in Uganda are still very high, yet we see that these chances are going down in other countries. So for many of us, it is still a struggle, especially since we've seen loved ones die from the disease, and yet we believe that there are people who could have been saved from dying from the disease, especially at this point in time. While the deaths during the first wave of COVID-19 may have been inevitable because not so much was known about the virus, many of the deaths in the second wave could have been avoided. Some people have died because they didn't access the vaccine that could significantly reduce severe illness. Some have died because they could not access the protective equipment that are critical for their line of work as frontline health workers. Some have died because they could not get the medical oxygen that they required and therefore died while gasping for air. Some people have died because they could not afford appropriate COVID-19 treatment. Some people died because someone stole the money for the medical supplies that could have saved their lives, while others died because someone wanted to increase their profit margin. In the process, we've lost loved ones. Those who make the statistics were mothers, they were fathers, they were grandparents, our boda guys, our chapati guys, our teachers, our neighbors, friends, and so on. So as we remember them, we need to honor them by making a call to action to the duty bearers and policymakers at the various levels. There is so much that urgently needs to be done to manage the pandemic, and as citizens, we need to do our part to push for the change that we need to see within our healthcare system. I want to thank all of you for making time to be part of this memorial. And particularly, I would want to specifically thank those who offered to share their experiences of loss due to COVID-19. And there are a number of Ugandans who have also shared stories, although they may not be able to be with us here tonight to speak, but also those who have composed poems that we shall be listening to tonight. So without taking so much time, I would want to welcome us to this memorial. And I really hope that after this engagement that we have had, we shall be in a good place, first of all, to understand why the deaths that happened, and to also be able to make a call to action to the powers that be in order for us to have a stronger healthcare system, because like I said in the beginning, the deaths in other countries are going down, but there are still very high chances of dying from COVID-19 in Uganda. Welcome, everybody. Back to you, Liz.
Thank you very much, Salima. Thank you very much, Salima, for welcoming us and putting this discussion into perspective. And it's true, so many people have lost lives. I see here on the chat, Agnes Chirabo just listing down the people that we have lost, that she knows that we have lost in memory of Simon Ngabirano, Tata Semugoma, Everest Kayondo, Gideon Bagadawa, Regina Muchivi, Aisha Nakasuja, Rita Nance Sereko, Dr. Charles Chigundu, Dr. Chisamba Mugera, Honorable Pius Mujuzi, Mujajas. So as we can see, so many people that we know, so many people that are known in our circles, those that we have worked with, colleagues, even within our communities have left too soon, and lives have been snuffed because, as Salima had said, someone didn't do what they were supposed to do, or the systems are the way that they are and are not enabling some people be able to live their lives to the fullest. I see that Evelyn says, I lost a relative, Mr. Muzawa Paul, due to the lack of a critical drug in the whole of Jinja and Mbale to treat the COVID patient. Evelyn and Chirabo, our hearts go out to you. Our hearts go out to you during this trying time. At this point, I want to welcome Mr. Chira Brian. Mr. Chira Brian, I see that you are with us. We'll take a moment to listen to a poetry recital. Mr. Chira Brian, you're welcome. Just enable your video and yes, we can see you.
The tides have returned to the shores, bearing an audit of men and women who braved the rage of the seas. We call them health workers. They return dead with weight of sailors who journeyed into the unknown, rowing the tide with their bare hands for oars atop a sinking boat. They returned to their mothers, necks stiff, faces the color of nothingness, a memory of promises lost. Another day, another statistic. 2,000 bodies and still counting. We are running a race of numbers. The blaring sound of sirens is witness, and the media has become a graveyard, a piggy bank of government's excesses. Private healthcare providers reign auctioneer while the public healthcare system remains a malnourished child, cowering under the shadow of empty promises. But the heads of the house have long been on vacation. And while away, visitors have pitched camp in their bedroom. They have taken to counting their wife's waist beads, and while at it, they have found a way of prematurely shoving whole foods down the throats of their winners. It's a game of figures. Check in before you can be checked in. This the new Hippocratic oath, and the price of breath suffocating. The highest bidder gets the bed. 2,000 bodies and still counting. We are running a race of numbers. The blaring sound of sirens is witness, and the media has become a graveyard, a piggy bank of government's excesses. Private healthcare facilities reign auctioneer while the public healthcare system remains a malnourished child, cowering under the shadow of empty promises. Again, we return. We return to the heads of the house, gasping for breath. Pallbearers bearing our mothers, sons, daughters as postcards. With stretched forward hands, longing for answers, but all we get is a sneer. We are told that security is priority. And just like the previous harvest seasons, the public healthcare system chokes on crumbs, and with it, its dependence. But our voices can no longer be covered under muffled whispers of resignation, of it is what it is. Because our grief hears no language of compromise. Our grief leaves us howling in empty hallways, dead in the night. Our grief knows that these lives could still be. 2,000 bodies, and tired of counting. Thank you.
Thank you very much, Brian. That was very, very profound. It speaks to the circumstance so many families have found themselves in. The fact that, as you said, it's a game of figures. And unfortunately, most of them and most of the people have lost their lives due to the high cost of treatment, of the COVID-19 treatment. And you can see so many things are coming up. The fact that recently over the news, there's been media attention on the lack of personal, private, personal protective equipment, the fact that there's been high costs of oxygen. Yesterday, I was at a hospital at about 1 a.m. and unfortunately, a patient had to go seeking for medical help elsewhere because this private hospital couldn't offer them the much needed help they needed at that particular time of the hour at night because the costs were just too high for them. And it's not like the person was walking or able to walk. They were at the brink of death, but they had to search for help elsewhere. And so many times, the experiences people face get lost in the figures. Our Ministry of Health posts figures about the deaths we've experienced, but these are real life circumstances that people have gone through. And so with that, I want to welcome Joanita. Joanita, you're welcome. I'll give you a few minutes to speak to everyone, to share your experience, to let us know what you went through during that time.
Thank you very much. I don't know if you can hear me clearly.
We can hear you very clearly.
Yes, so my experience was that, first of all, I lost about 9 relatives
but I'll talk about my grandmother. She got the vaccine a week before, about 2 weeks before her death, so we thought she would actually be okay. So somehow she got, after like a week of being vaccinated, she started getting high temperature. She began complaining of temperature, problems in breathing. So we took her to Nakasero Hospital. And when we got there, they told us they had to first do 2 tests, the PCR and the other test. And then they told us that she had COVID. So I don't know if she actually had it, or I'm not sure, but they told us she had the COVID. So they told us that they had to put her on oxygen there and then because her lungs had got damaged. It was so quick. And they were like, but you have to first pay, you know, before we actually work on her. So the good thing, we had some money, so we had to pay. In just those few hours, about 5 a.m., like just to get her on oxygen and everything. But then in Nakasero, they had no beds. So we're just in a, you know, in a chair, standing, very uncomfortable. But the hospital was like, they are going to call other hospitals to find out if there are beds. So they kept calling the entire evening till the night, and they kept calling around Kampala hospitals if beds were there, if there are free beds. And finally, we got a call from one hospital that there was only 1 bed. But since I put her on oxygen, they told us that, oh, no, we can't take off the oxygen. You have to call an ambulance to go with her. You can't just take her in your car. That's another expense. So we had to call an ambulance, which took some time. Then we took her to that hospital in Kampala, which I'll not mention here. But when we got there, the nurses took their sweet time. Receptionists were rude. And then they told us first pay before even touching her or anything. About 5 a.m. a room. And then they told us, now from now on, you can't be able to see her. And then we said, but we came with her, and now we are isolating her. Like, it was very harsh, because being an old woman, I know she liked to be around people she knows, because it would give her comfort. So after that, isolating her, we couldn't see her. And then the next day, my uncles tried to go there to take for her, you know, just like check on your mother, see how she's doing. And then one doctor told us, she's much better. So we're like, so is she off the oxygen? He said yes. So another doctor came out. We were like, how is she doing? And then he told us she was not doing well. They had to put her on some other machine to, I don't know, breathe for her. So in just about 2-3 days, we got very many contradicting reports. The hospital was full. They never had proper information for us. She was isolated, she was alone. And then, so we didn't really know what was going on with her. Like, we couldn't even talk to her, we couldn't see her. And then we asked the nurses, can we at least peep or something? And then one nurse told us, oh no, she needs to be, we're going to put a tube inside. Like, there were so many contradicting reports, and it was so absurd, like, for her to pass away on her own with no one by her side, like no one she knows. So after isolating her, and then again, they told us you cannot see her. Monday, Tuesday, Wednesday, this was Sunday. Monday, Tuesday, Wednesday, Thursday, no one was allowed to see her. So we're like, we need to know the report. What's the progress? Like, someone should give you something. So we got 3 contradicting reports. One doctor said, oh no, she was sitting up and she was talking, she was fine. And her test had come back negative. Another one told us, no, she wasn't breathing well. And another nurse told us, she's so friendly, she was talking to people. So we're like, so if she's talking to people, let's see her. They still refused us to see her. She was still isolated. So anyway, long story short, we couldn't see her, we couldn't do anything. And the day she passed away, my aunties kept insisting, we need to go and see her. So my sister went there to the hospital. And when she was there in the corridor on the 6th floor, because it was the COVID floor, the nurses kept passing. And I'll say this in Luganda, they kept saying, like, it's like we had brought her grandmother and dropped her there. We didn't want to check on her. And yet, there was another woman who was refusing us to go inside to see her. And now the nurses are telling us we neglected her. Like, it was just a jumble of things. Like, it was very, very unfortunate and very, very frustrating.
Juanita, we seem to, you're breaking a little bit.
Maybe it's the network.
It's okay. We hear you now. We hear you now. We are with you.
Okay, maybe I'll just summarize. Okay, so then, in other words, she passed away, but there were so many different reports, contradicting reports from the nurses, and they end up putting her on oxygen without asking the family. Then they told us they were going to put a tube inside her. So it so happened, they made a decision to put a tube, I don't know, they call it a machine which breathes for her. And in the process of doing so, her heart became tired, and then her lungs got cold, and then she got cardiac arrest, then she passed away. So on that day, they didn't tell us she had passed away. So we kept insisting, we want to see our patient because you've been isolating her for so long. But again, they didn't want us to see her until my uncles and aunties quarreled. That's when they said, okay, she died. Then we're like, yeah, but we've been coming, we've been asking for feedback. So they told us, no, we are putting a tube inside her. Like, it was so bad, like it was very, very bad. And then after that, we were like, okay, we want to take the body. They told us, no, she must spend the night, because I'm sure they wanted just to make an extra buck from her staying over. But we were like, no, because the bill was already so high, it was over 25 million in just those few days. So we were like, no, we need to take her. And they had refused. Again, we had to quarrel and fight. My aunties, uncles, the whole clan, like people, we drove our cars there and said, we just say yelling at the nurses, give us the body, give us. So in the end, they put her outside. Imagine, on a bed, naked, no bed sheet, no polythene, nothing. And they were like, no, she'll contaminate the other bodies. So we're like, hey, at least put something, cover her, because my uncles and like at least something. They said, who are you? So the doctor came and told us, this is your bill. So we told her, okay, we told him, okay, give us the remaining stuff of Deja, the clothes and what. Then he told us, I won't touch infected things. He said, but no, you've been doing rounds. Just give us her things. He refused. And then another nurse then helped us get them. She was like, no, first spread them and then give them to you. So anyway, in the end, we called A+, who came for the body, and then they're the ones who came with a small suitcase and put her in. And then her getting the papers for the death certificate. The man took his time. He was dilly-dallying, jazzing with his friends. It's like we were asking him to give us gold. So anyway, in the end, he gave us the death certificate. But I think I have an uncle and auntie suffering from COVID right now. And also I lost 9 relatives from COVID, but I realized that isolating them is what is actually killing them faster than the actual disease. Because like Jaja, was alone, and I know she likes to be with people she knows. And so also the isolation summarized my experience. Like, it wasn't so good at the hospital. The nurses were so rude. The doctors kept giving contradicting reports, and there was so many. They were like, the bill would increase like in a day. I remember the bill increased from lunchtime. In the morning it was 19 million. After lunch it was 24. Like, money before they treat the patient. Medications are difficult to find. Yeah, but for all those who lost their loved ones, may their souls rest in peace. May God continue to comfort us all. But the hospitals should really revise their way they handle such cases, because my experience was so bad. Yeah.
Thank you very much, Joan, for deeming us worthy to share your experience with us.
Yes, maybe
you, the family.
Just one thing. I've seen a statement there that they wanted evidence. Yeah, there's evidence. The nurses, doctors, the hospital, we made noise at the hospital.
We'll hold on that litigating for now. Today we shall focus.
So we just don't want to mention names and everything. Yeah. So thank you.
Yes. Thank you very much, Joan. I see Lydia Ocheng is saying today she has lost her cousin, but she couldn't travel to Kalungu. May his soul or her soul rest in peace, Lydia. Our heartfelt condolences to you and the family. Joanita, you point out a number of things that we see coming through in so many people's testimonies. The fact that there were high costs related to the COVID-19 treatment. You had to pay about 25 million. It just shot up in a very short space of time. the fact that there was a lack of information around what treatment, what stages that your Jaja was going through treatment, and that you were just shocked a day after her passing on. And that's very, very unfortunate. You, like so many other people, have gone through these experiences and have cast the system that they have had to go through. We again send our condolences to your family and thank you for sharing your story. All right, now we shall have Sisi. Sisi is with us.
Okay.
Is Sisi
yes,
with us?
I am. The only issue will
yes,
be
Sisi, if you deem it worthy to.
I think my only challenge will be the network.
To put on your video? Oh, yes, we see you.
The video is on, but the network is a bit cracky. So at times with the video on, somewhat affects the quality. So I could still do the video, but well, I hope I don't get off.
Okay. Let's see how that goes.
Elizabeth. I think, well, before I go into my story, I think for me as a point of reflection is that this was a pandemic, and one of the issues that we need to ask ourselves is whether our government was prepared, because we saw this coming. It wasn't something that just came out of the blue. It is something that government knew because it kept on hitting the entire world. So the whole issue as to the preparedness of our government and the whole issue of the health sector in the country, I think for me is one of the things that we need to critically look at, because it's very, very important. Now, I think, well, for me, my story starts with, well, it was my dad. He tested and he wasn't well. So we had to rush him to one of the hospitals. And well, the private hospitals, one, the beauty is with doctors that were treated, the doctor, he also knew me, so that was a starting point. Eventually, of course, mom also tested. Now, when mom tested positive, she started taking some medication at that same. Excuse me?
Hello, Cecile, we seem to have lost you there.
No, I just went off a bit. So anyway, she started taking medication like for a week, and we thought she was going to be okay. Then fortunately, I think a week later, she had to be brought in an ambulance to the same hospital where dad was. Now, dad didn't know that mom actually was in the same hospital. So mom was downstairs, dad was upstairs. Of course, mom knew that dad was there, but dad didn't know. And we all knew she was going to be okay, because the doctor said that, well, she seemed relatively okay, and she seemed, of course, younger than that, so she should pull through. But eventually, I mean, just went for the worst until she passed on. Now, we were challenged. We couldn't tell our dad that mom had passed on, because for like 3 or 4 or 5 days, she would go upstairs and check on him. So we were a bit confused. Should we tell him that the wife has passed on? Should we keep quiet? So like for 3 days, you know, we're in that maze and we didn't know what to do. So when we spoke to one of the doctors, he told us, you know what, at the end of the day, you still have to tell him, because this is the wife. So yes, we told him, and I mean, it was a bit of a shock to him, because he knew that mom was okay. So we had to bury mom. Dad couldn't bury. Then that seemed to be improving. So I think after like 3 or 4 weeks, well, being a doctor, he told the fellow doctor that I think I feel fine, I need to go home. So we took him home. Of course, by the time we took him, we had paid over 90 or so millions in treatment. And of course, mom passed away on Christmas. And I think for me, one of the things that stood out for me during that time was that I mean, people are celebrating, but you are hurting, and it's Christmas time, but instead it is the reverse. It's one of those things that hits you really as a human being. So of course we took Dad home, and the following day he wasn't fine, so we had to rush him back. Now that was on the 31st. 31st, they now just had to rush him to the ICU, and yet when we brought him back, when we'd gotten him back, he was fine. But 31st, now we had to rush him back to the same private hospital. And well, I think again for me the irony was 31st people were celebrating, but we're in the car in the parking because now he's in ICU and it was seriously raining, while other people were, you know, happy celebrating its new year and things like that. You are, you know, this side of, you know, the world is totally different for you and the people that you're with. Of course, he passed away after 4 days. And interestingly, I think after like 4 days, I think we'd paid a bill of over 20 M. Now, that is excluding the other bills that we had paid before, just for the ICU. And for those 4 days that he was in the ICU, you had to pay a bill of over 20 million. I mean, without even considering the other one. So I think it is just sad. And of course, the psychological torture that and the trauma that people go through, it's one of those that is very challenging, especially for parents. And I think for us as kids, we're very, very close to our parents. So it gives you all these thoughts. You never imagine that both of them would have to die at the same time, probably. The ideal thing that we always think is, okay, probably one of them will pass away, then you stay with the other. But I mean, just within a spell of like 8 days, Dad also passed away. So yeah, that is my story.
Thank you very much, Ceci. Your story is, I don't have words, because being able to let go of one loved one is one thing, but having within a space of just a matter of a week or two to also have a second loved one depart is really challenging. Our hearts go out to you, Ceci. We pray that you may be strengthened during this time, and that the family is able to go through this process and even move forward. He had to go back for more treatment when he was sent. That's about 120 million just borne by one family that has had to go through the burial expenses, the COVID-19 treatment expenses, the other antecedent expenses related to such a period of time as that. So the high costs of treatment, again, just do come up and even make the situation much, much more worse than they could be. And for you, Ceci, your family, perhaps at that juncture was lucky that they could afford. But so many have been left at a place where they have no choice but to accept the untimely death, even before all that could possibly be done is done. I know so many of us saw that the news about the gentleman that had his wife removed from oxygen because he couldn't come up with any more money. And that is just tragic. That is just tragic. Our hearts again just go out to every single person that has lost their loved ones and everyone that is struggling to cope during this moment. Right now, while we were registering for this memorial, so many people came up and they want to speak. And I hope you are able to connect there. I don't know if Kembabazi is with us. Kembabazi, are you with us? I would like you to share your story with everyone. If Kembabazi is not with us. Kembabazi, if you're with us, please connect. But if Kembabazi is not with us, I will have Charles Donaldson. Charles Donaldson, we would love to hear your story. You shared with us a very profound poem that we hope you would also let the rest of the people on. Yes, Charles, I see that you're connected. If you can. Thank you very much, Charles. You're a little bit upside down. I can see you very clearly.
Is that okay now?
Yes, now it's very fine. We are running short of time, so and we want to hear every single person's story. We want to be able to collectively.
So we can have our thoughts with those who lost their dear ones, myself inclusive. And I'm going to be reciting the poem. It is entitled "The Corpse I Talked to." Do not my life is of togetherness. It's a thief that stole my life. Weep no more. My dear life is no more. I feel for the tears rolling down your cheeks. Yet I can't stand shoulder to shoulder with you. All the tears are for the life I lived that was stolen from you by a virus we didn't know where it came from. You will cry and wail, but I am no more. Speak out to our living ones everywhere. My life is no more. Let everyone take care from the thief that pilfered my life. It's your fellow feeling that will set me to rest. But I decamp you with a message. Your love is so adorable. So preach love to everyone everywhere and let them take care from the thief that embezzled my dear life. I'm at peace with your eulogies, dear loved ones. Thanks for your care. You are my betrothed. Above all, speak out for our government to improve on our health systems. I wouldn't part ways with you, even if it were not because of the impoverished health systems. I'm gone to my resting hours with peace and happiness. You showered me with beautiful thoughts. Your tribute humbles me, and may the love of God reign upon you all. Thank you. This is all I have cited to share my thoughts with those who lost their loved ones, myself inclusive.
Thank you very much, Charles, for penning that wonderful poem and for sharing it with us. It's true, we've lost so many loved ones untimely to COVID. It's come like a thief. Charles says we don't know where it came from, but he also calls upon us to hold the government accountable, to ask the government to put systems in place that are able to ensure that no one feels the loss that he did. No one has to lose a loved one again to the pandemic. And this just brings back a lot of the issues that people have been coming up with, the fact that the costs are so costs are in private health facilities, because the government health facilities, the costs are minimal, if so, and shouldn't even be there in the first place. But because we are in a system where we are forced to run to the private because the public is not sufficient enough, we find ourselves losing loved ones because of this. Thank you so much, Charles, for helping us share in your grief and allowing us to be able to grieve collectively with you. Right now, I don't know if Kembabazi is back on. I think I saw a chat. Kembabazi, if you're on, we would want you to come and share with us your story. Kembabazi Masi. If Kembabazi is not on, we will go to Karamba Drame. My pronunciation might be problematic. I hope I'm getting it right. But Karamba Drame, you're welcome. Karamba Drame, I invite you to take center stage and just share with us what you went through. Which loved one is no longer with you? What experience did you go through? What happened? Could the death be avoided? So if it's an issue of, I don't have money for oxygen, that could simply have been avoided by ensuring that the government invests in ensuring that oxygen is there for everyone. But if Karamba is not on, again, so many people just reached out and they wanted to share and let us know what happened in the event that their loved ones passed on. And if Karamba is not on, we can always come back to them. Might be we could have Flavia Komukama Flavia. Flavia Komukama. Flavia Komukama. If Flavia Komukama is still getting ready, just to ready herself to again share with us. In the interim, let's have Labila. Labila, you're very welcome to share with us during this time. Labila Musoke. Just to say, it's going to take effort from us all to be able to have everyone share their experience and share their stories, simply because sometimes you ask someone to share. Yes, Labila, are you with us?
Yes, and thank you, Elizabeth, and sincere condolences to everyone. And you showed strength to share these stories. But at this moment, I would love to call upon Humphrey to share his story as I get myself together. The stories are really depressing and saddening. Let's call on Humphrey, please.
Thank you very much, Labila. We'll give you some time to ready yourself, and we'll just ask Humphrey. Humphrey, if you're with us, just share your story, start up your video, start up your audio, and we are here to listen to you and to share collectively with you. Humphrey? Okay. It seems some people just need time. The stories have been really, really touching. Let me just, allow me to just ask Agnes Durable. Agnes Durable, you're very welcome. Miss Agnes Durable, you're very welcome. Just start up your video microphone and let us hear from you. Let us hear what happened, what challenges you've gone through. I saw on the chat you listed a number of people that you know that have passed on as a result of the pandemic, and we want to collectively grieve with you and just hear your experience. Yes, Agnes, we seem to have lost you a bit. I can see that so many people are coming up and saying, indeed, enough is enough. They are thanking ISER for organizing this memory of the departed souls. May their souls rest in peace. Agnes, I see that you're connecting.
Yes,
I think,
I'm here now.
You must be, oh, wonderful.
Yeah, and thank you so much, ISER and everybody. We don't know how to pull ourselves up because amidst mourning those that have parted, there is also another burden by our side of the so many of them that are still battling the disease. Family members, personally, a doctor on round every morning, checking on my family members, checking on my colleagues at work. So by the time you're done with the ward round, you're sick yourself. I think we share experiences just like others are accessing medical treatment. But personally, I wanted to talk about in respect of the immediate family. I'm not going to mention one of those people I listed. I wish only to share about the burial process. This gentleman was diabetic, and then he was declared that he has COVID, but had to do home-based care. He deteriorated, and when his wife was rushing her to hospital, he passed on in the vehicle. So they had to drive back, prepare him, dress him up, order for a casket, and after organizing everything, they called in a funeral company. So the casket was already available. The body had been prepared by the people that are taking care of, the family people. Everything had happened in the house. So the funeral company appeared and gave this family 5.5 million minus the casket, and 5.5 million taking away the body and taking it to the burial place in Masaka the next morning. So the issue of burial is another issue, is another trauma. All of us, we have witnessed the drama that these funeral companies put across during burial. It is so traumatizing. And the homes where such people have been buried, they are no longer part of a community. Nobody wants to go there. And that trauma has primarily been caused by the people that come to do the burial. So we had not to do the burial on the day we had wanted to do the burial. The funeral company had to decide, and yet they are charging for every other day the body spends in their funeral home. So besides the costs that these families are shouldering in hospital, the cost and the manner of burial, I think it is another thing that we need to discuss and we need to resolve on and advise we can do better. What about the poor? Will they not bury their loved ones? I submit.
Thank you very much, Agnes. Our heartfelt condolences for all the loved ones that have passed on. And you bring an issue to the forefront. You get us into another perspective of the post-passing experience of a family that has lost their loved ones to COVID-19, the costs of not only hospital, but also the funeral companies, these companies that organize for funerals, the fact that there are particular measures that must be followed when a person has passed on, that the barriers are not the normal barriers that we are used to culturally, but you are taken to a place where you must pay exorbitantly just to have your loved one buried. And that in itself is just disheartening for someone that has just come into the process of grief. And that just speaks to the profiteering motive of so many service providers that offer services after the death of our loved ones. We are sorry you and your family had to go through this. And we hope that, although we know that so many like you are going through the same experiences, we hope that moving forward, we can at least push for a change in some of these circumstances so that no one else has to experience what you experienced. At this juncture, I want to call Alan Abenawe. I'd like to invite you to share your experience. Alan Abenawe, are you with us? And I know having to share these experiences, so many things are just coming up, so many experiences that we hope that we would not have to live through again, we are living through again. And so it's important that even as we seek help. Yes, Alan. Alan, we can hear you.
Are you okay?
Yes, Alan.
Alan Abinawe, and I am also going to share on the 22nd of June. I said audio. On the 22nd of June, we buried my auntie. Of course, the story is not different from what has been shared, but I think what is different is that the starting point. For us, of course, this auntie of mine communicated to us. She was in the village, we're in Kampala. Our village is in Chiruhura district. And she told us of, how she was developing this severe headache, and her temperatures were high. So we advised and said, maybe you should actually go and have a COVID checkup. The nearest hospital is called Rushere Community Hospital. When she arrived, they told her they did not have the equipment. So if she was, allowing and waiting, then they would maybe the next day call her and test her. But of course, when she went back home, she still complained of the headache and fever. So we called one of the doctors in Barara, and he said if her temperature levels are high and she's complaining of headache, the that must be COVID in one or the other. So the next step we thought about was then maybe we should go to Mbarara Referral Hospital and have her taken care of there. But when we called that same doctor, he told us here, we're overwhelmed by patients. There are very many people who are coming in, COVID patients, and we have oxygen shortages. So if you would want mediocre care, I'm going to state it the way he stated it. If you would want mediocre care, maybe you can bring her here. But if you feel that her life still matters, then you should, as soon as possible, try Kampala hospitals, because maybe there you will find a hospital that is not choking on COVID patients, especially private hospitals. And of course, we did as advised. We had to bring Kampala. We had to take her to MedPal. They tested her and checked her. They found she was COVID positive, and they told her that, of course, the money, the starting money was going to be between 5 and 6 million. Then we called the family doctor, and he advised us that because the costs are going to be so high, if a hospital is going to take care of her, then maybe we should do an in-house treatment. We get an apartment, we rent it, then we take her there for her to be receiving her medication. We did that as advised. We had to rent one of the apartments in Ntinda, known as Evelyn Apartments, and we got a personal doctor to come and be checking on her, of course, morning, in the afternoon, and in the evening. Of course, we were spending, but then I think it was 4 days when we had started the in-house treatment, and her condition deteriorated. We were advised that we can no longer keep her in the in-house treatment. She now needs to go to a hospital and access the required medical care. We are going to meet the bills even if we want, even if we do not want. So we tried out at back at MedPal. Of course, the costs were so high. And then a friend of ours called us and told us that Paramount Hospital would be cheaper than MedPal, and that's what we tried out. Of course, the costs there were also so high, and 2 days, I think she was in their treatment for 2 days, and you know, the Lord called. Hello?
Yes,
Are
we
you
can hear
getting me?
you very clearly. Yes, yes, we can.
Okay. She was at Paramount Hospital for 2 days when the Lord called her, and we lost her to COVID. And of course, as previous speaker stated, you know, when you lose a COVID patient, then you have to follow the required procedures of calling the so-called funeral services to actually come and do the burial on behalf of you people. It was so hard, but we had to incur the costs at the end of the day. Truthfully speaking, it's not that we have finished paying the money that we incurred in her treatment. We are still doing everything possible in order to fulfill and pay the expenses as required. But conclusively, I would like to say that as a country, me, in this period, I have learned a lot, that as a country, we have not prioritized medical sector. I believe the only thing that we give priority to is security and not the medical sector. It befits my understanding. Last time when I was watching the TV, I saw the president say that as a country, we had estimated that we are going to have around 4,000 ICU beds, but these people did not do as I ordered. And then he called them forward. And do you know what he said? He said, these people are a gem. They did not do as I had stated. To me, if a person fails to do what he or she was required to do, and because of that, very many people have lost their lives, you do not just call that person and refer to them as a gem. Do the necessary. if she has failed to do what she's required to do, maybe let her leave. She cannot serve as a permanent secretary because very many people have lost their lives because of her negligence. Then to the private owners of these hospitals, what I found out is that most of them have benefited, and I can say most of them are now trading in lives, because the last hospital we went to, the gentleman boldly told us that if you do not have 6 million Ugandan shillings, don't even bother. First bring the 6 million Ugandan shillings for us to talk about treatment and for us to allow your patient in the hospital. So that's it on my part, but we need to do better as a country.
Thank you very much, Alan. And yes, we do need to do much more as a country. It's not acceptable that having lost a loved one, you are left with debts and even more impoverished than when you began that journey of loss. So a lot needs to be done, and that's true. Things around regulating private healthcare providers, the fact that our public systems need to be prioritized even more by this government, having to move from Bushiri to Kampala just to access a service isn't something that we should accept and sit down, knowing very well that her life could have been saved by the facility closest to her if only what was done was able to be done. Our condolences go out to you for your loss and to your family. May you continue to be strengthened and may you be able to find some glimmer of light in this dark period. Right now, I want to invite Lydia Obo. Lydia Obo, I see that you joined us. Juliet Cynthia says that Mercy Kembabas is not able to join in because her network is giving her challenges. Wherever she is, Mercy, we still send out our condolences to you and the family. Yes, Lydia, you're welcome.
Thank you very much. Can you hear me? Thank you very much for giving me this opportunity. We can hear. And I must also thank the Uganda Law Society for organizing this. I've been one of those who have been pushing that we have this kind of gathering so that we can remember our departed, especially our departed colleagues from the Law Society who have passed on. A lot of, I could see every time I open my email, I see an announcement from the Uganda Law Society, and it's very heartrending. And I've been saying we need to gather, remember our colleagues, but also remember everybody else, that because everyone, from what I've just heard, is hurting. As I said on the chat, today two people, they buried my cousin. I've got an aunt whom I just have not buried, but as I speak now, I've lost two other people, you know, and I'm like, okay, one of them, they could have buried him today because he's a Muslim, so I don't know what has happened. He used to be our driver, and we can't go, we can't do nothing. So that's a story that I think every one of us has to tell, and each one of us has got a different story. But I think for me, I want to bring a new message, a message of hope, because in times like this, I think we get lost for words. We don't know what to do. We don't know where to run. We cannot work because there are so many things that are happening. And each and every one of us has got a pain and a challenge, whichever it may come. So I'm glad that I think the Uganda Society has put out for us messages of where we can run to if we need counseling, if we need to speak to somebody else. And I think what we need to now do a little bit more than what we have been doing is to call up each other and talk to each other and find out how we are doing. So for me, I'd like to say two more things, and I'll leave the podium. The first thing is that I think as a country, we need to intently look into our herbal medicinal approaches. And I'll use the example of a country like Sri Lanka. In Sri Lanka, they have done a lot of research in their traditional herbal healing capabilities. And they have got a whole, I think it's either a university or a whole faculty as part of their medical school, where people go to study and to learn how to use herbal medicines as a way of treating illnesses. Because what COVID has shown us is that there are many ways of skinning a cat. And I'm not saying that we should abandon what we think is the traditional medicine approach, which I appreciate very much, which is really what they call the science. But I think the country needs to examine and intently go into a full-blown research into our plants and what they can hold, as a way of probably even we trying to start making our own medicines, because most of these medicines we are taking and borrowing and buying from elsewhere are made out of plants, of medicinal plants. So that's one message. Then the last message to me is that is we need to find a way to raise ourselves up. And for me, what I do is that I like listening to music. I like listening to church music. And it really speaks to me a lot, and it makes me to be at peace with myself. So there is a song that I'd like you to go back and check on, and those of you who can, regardless of your religious calling, it says, "When I am down and all my soul is so weary. When troubles come and my heart burden be, then I am still and wait here in the silence until you come and sit a while with me." So it's the Lord raising you up, okay? You raise me up so I can stand on mountains. You raise me up to walk on stormy seas. I am strong when I am on your shoulders. You raise me up to more than I can be. God bless you.
Thank you very, very much. We know and we pray that all families here will be raised up. Every single person that has lost a loved one may be raised up, but even as a country that will be raised up to deaths that we have lost untimely, that we put an end to it and ensure that everyone's life is saved. Thank you so much. Right about now, I'll invite Dr. Frank Asimwe. Dr. Frank, I see that you're with us. Please, Doctor, the floor is yours, and we are ready for you.
Brethren, good evening, ladies and gentlemen. My name is Dr. Asimwe Frank. I am here on behalf of the Uganda Medical Association, where I serve as the chair for welfare. But otherwise, my day job is as a consultant urologist in Mulago National Referral. So by my job description, I don't treat COVID patients, but that is where the story starts and actually ends, because there's no doctor who does not interact with COVID patients. First of all, my sincere condolences to all of us who have lost relatives and loved ones, who have suffered loss of, those loved ones, and then suffered lots of financial cuts. It's very grave. As doctors, we are in two worlds. One, we are human beings, so we also suffer loss. We've suffered loss. We've suffered sickness. But we are in the world where we care for the people who are sick, and that's a different ball game altogether. Over 2,600 health workers have been infected, and of those 35 have died, and of those 35, 16 have
Doctor,
adopted.
we seem to have lost you.
Can you hear me now?
Yes,
we can hear you. We can hear you.
Louder. I could actually hear you.
So I speak louder?
Okay, that volume is fine.
Okay. So I was just about to say that this does not even compare so much with the lady, I think it was Namtevi, who lost 9 relatives. That is so bad. That is so hard. So the losses cannot quite compare with individuals who have lost. But as doctors, one of the issues we experience is initially, before we get to sickness, is the fear. When you're hit with fear, when the pandemic comes and everyone, but for you, you must go to work. It is a very daunting feeling. You fear to get exposed. You fear to go in and then get sickness and then bring it to your family. You feel like you're going to be the weak link in your family. While everyone is staying home, you're the only one going to work. Then you come and bring it. So that fear can cause a lot of psychological trauma. Then the next biggest fear is when you fail to help your patients. Doctors are grossly underpaid, as we all know. But our biggest satisfaction is when we treat patients and they get better. But when a disease comes where your patient don't get better and actually go on and die, that becomes even worse. Day in, day out, you walk in, someone dies. When you hear stories that we are waiting for an ICU bed to open up, in most instances, they are waiting for someone in the ICU to die, to pass on. Now, it's a big loss for the family, but even for the doctors in care, it traumatizes us so immensely. The other issues which hurt us most, which traumatize us the more, is when our patients cannot access the ICU beds. You know what to do. You know this patient now needs these levels of oxygen, but the oxygen is not there. This patient needs to be moved from the general bed to the HDU. The HDU bed is not there. It needs to be moved to an ICU. ICU is not there. Patients have come, the ambulances are parking outside waiting to access, but the beds are not available. That traumatizes us when you see there is at least something you can do and you can't quite do. What has hit us closest to home is also the loss of our colleagues, people we've worked with, people we've trained with, people who have trained us. In just the last, this week has been fairly quiet and we thank God for that. But the 2 weeks before that, we lost 6 doctors, one after another. There was this very prominent neurosurgeon who died. There are about 5, 6 neurosurgeons in Uganda. This man just died, and he was a very active member of a surgeon. He used to talk to us, counsel us, pray for us. He was very religious, and he succumbed. Dr. Mtumba, the pediatric surgeon, so many doctors who have died. This young lady who died on the way from Gulu, who couldn't access the ICU, died along the way. There was another very young head and neck surgeon who had just returned from the US. One of the only 2 chest head and neck surgeons that we had. Very big losses. And every time a colleague dies, the next question is, am I the next? Am I the one? And hits you hard. In the midst of this, what hurts us most for us, the doctors, is when we now cannot protect ourselves effectively. You need PPEs, and they're not there. They're not adequate. You need a very simple mask, and they are not there. When you're lucky, you get 1 mask in a week. You find yourself recycling masks, and you wonder, what is this? And then when you hear stories, National Medical Stores, they say the masks are here, but they're not reaching us. That demoralizes us completely. Of course, the oxygen is of everyone. When either we are sick or when our patients are sick and there's no oxygen, that becomes a very big problem. I'm going to be brief, and I'm going to just share with you what we think needs to be the way forward. As we have seen in the world over, this pandemic is in waves. The first wave came, and we all thought that was the end. Unfortunately, our government and the powers that be did not prepare for the second wave. And if we're not careful, when the third wave comes, we may find ourselves completely unprepared. So these are what we think we need to do to prepare for the third wave. And as we have seen, the subsequent waves seem to be worse. We're now talking of variants. We started with the ordinary variant, the ordinary coronavirus. Then it began mutating. Before we knew it, there was a South African variant. Then now there's the Delta variant from India, which is making rounds. We hear the English variant, the UK variant is even worse. Even within Uganda, a new variant is coming up. So subsequent waves seem to have much more virulent variants and more deadly. So the best thing we can do during this lockdown, even as we are battling this wave, is to have people vaccinated. Our government must do all it can to secure vaccines and bring them, and we must get vaccinated. While the government is not buying enough vaccines, we were also dilly-dallying, including my own colleagues, my fellow doctors. When the vaccines came, people dragged their feet. Of course, I know there are people who have died after being vaccinated. That's notwithstanding the biggest weapon we have against this disease. Next, government must really get PPEs to protect the health workers. There should be no one who should see a patient. I'll just give you an example. Just the other day, I've told you I don't see, I see, I am a urologist. So when a patient who has COVID has a urological issue, they call me. I've been to the ICU twice to see patients with COVID, but with urological issues I go. But otherwise, I see what I think are non-COVID patients. On Monday, I was seeing a patient with urology issues, old man prostate issues, and he was with an attendant. I saw him, examined him, finished, but he had that patient had been sent by a colleague. Now, when the patient had gone to the lab to do some tests, this colleague came and told me that, hey, by the way, the lady who was with him actually has tested positive for COVID. Oh, I was taken back. And so I said, now we need to test the old man as well. And indeed, when we tested the old man, he was also positive. Now, that is how most of us are getting infected. When we are seeing what we think are non-COVID patients, and then we lower our guards, and then they turn up to be COVID positive. So government must provide PPEs for all health workers at all times. Back to our personal, the individuals. After trying to get vaccinated, we must keep our masks on, please. Hand hygiene, sanitization, and washing. We must make sure if you are not essential, now this is a bit of a problem. Staying at home vis-a-vis going home, going to work. There are economic pressures to go to work or socialize, but then the issue of staying home is very protective. We must ensure social distancing wherever we are, so that this wave passes. Now, on the side of government, this is the time to bring in all the beds which were supposed to be set up for isolating and treating COVID patients. If government had enough beds, this issue of exorbitant charges in the private hospitals would not arise. If we had learned from the first phase that we need more ICU beds and therefore put them in place, by now government would be treating its own people. This needs to be done now, because this wave probably will peak and plateau in July, which we're in. Maybe it's already plateauing, and maybe go down in September. Then come November, December, I don't want to be a prophet of doom, another wave might come up. Now, by the time that wave comes up, we need to be ready. The issue of oxygen, there is no reason why you cannot have enough oxygen in all those beds. And this is where government can actually do this public-private partnership. These private hospitals can also be supplied with oxygen. Then when they're supplied with some of these things, then they will be put on the spot to reduce the cost, because government is subsidizing some of those costs. The last speaker talked about herbal drugs and the therapeutics. Government must encourage, and we're seeing this COVID coming in, must encourage, finance, and help anyone who thinks they have got a curative remedy to take it through the scientific rigor. Now, I need to slow down and try to explain something here. I personally think this drug COVID.
Thank you very much, Doctor. And just to say, yes, so many issues are being highlighted, but just for the sake of others to also share their experiences, I'd request that you summarize in a few.
Okay, thank you very much. So government should try to do scientific studies on these drugs so that we are okay with our own products. Finally, I would want to share with you what I think is a little bit of a positive. When you look back, there have been pandemics in the world. In the 1918, 1919, there was a pandemic. However, this time around, we need to thank God for a few things. Interconnectivity, the internet that we're doing now, the ability to reach one another via these technologies. We need to thank God for that. We also need to thank God for the scientific innovations. Finally, I want to share with you a verse, Hebrews 13:5. Let me just read it from my amplified version. The second bit. I will never, under any circumstances, desert you, nor will I give you up, nor leave you without support, nor will I in any degree have you helpless, nor will I forsake or let you down or relax my hold on you assuredly. Thus says the Lord. We may have lost loved ones, but the Lord is reassuring us that he will not leave us nor forsake us. I pray for those who have lost loved ones, those who are unwell, may the Lord comfort us. God bless you.
Bless you too, Dr. Frank. You highlight so many things. The fact that even as a doctor, you have the fear of walking into the hospital to save the lives that you're supposed to save, simply because you do not have PPEs and you must use a mask for a week. These are very unfortunate times that we are living in, and we shouldn't have come to this point, given the fact that our government had a lot of time to prepare, even before this very deadly variant hit. At this point, I would want to welcome Labila Musoke. I hope now you are ready to address us. We'll just have a time to put our thoughts towards all those that we have lost, and to just think about them and pray for the departed, and just have a moment of silence. Labila, the floor is yours. Labila, if you could unmute your microphone, we do not hear you.
With our lost ones, we dedicate this moment of to everyone who has died during the second wave, particularly during the 2 months that we have lost so much lives. We affirm that we shall rebuild our public health systems and boost health worker morale, make our health systems effective, accessible, and equitable. And without this, we cannot achieve our population health. For this moment, we reaffirm that the struggle for quality public services is a struggle for equitable health services. At this moment, I call upon everyone to turn on their videos, and we dedicate this moment for a collective moment of silence to all the lives we've lost during this moment. Please turn on your videos, and whoever has a candle nearby, feel free to light it. It will be 2 minutes. Everyone can say a prayer in whatever faith you profess. Thank you. With me,
May the souls of our departed rest in peace.
Amen. Amen.
Thank you very much, Labila, and thank you everyone for taking a moment to just remember everyone whom we have lost. So many lives have gone ahead of us because of this pandemic. I see Agnes is saying upgrade us, Agnes. My network seems to be failing me. I hope you are all able to hear me, because I am going on and off. Flavia says, please unmute my video for me. Please unmute me. If I will be able to continue. Flavia, you can just unmute your mic, and then I'm sure you've been upgraded by now. You could enable your video and we'll be able to see you. Yes, we can see you.
Thank you.
You're welcome, Flavia.
Hello, everyone. Can you hear me?
Yes,
yes, we can hear you.
I'm Flavia Chomkama and I work for AGA. And I would like to sincerely condole with everyone upon the sharing they have done with us this evening. I would like to say that it's been a tough time for us. I'd also would like to say that we have had, as I live with HIV since 1994 to date. And I've observed that over the last year, we have lost several district forum for people living with HIV leaders to COVID and to loneliness. I think the pressure has been a lot on them. They had no one to talk to. There was everyone asking them what to do, and they were exposed because they have a lot of responsibility in supporting delivery of medicines, supporting delivery of foodstuffs where they can, and also home-based care. So it's been a very hard task for the leaders of persons living with HIV. And when it comes to COVID, we were told, as the persons living with HIV, we are more at risk because we are already immune compromised. But at the same time, people like me who are above 50, we are also, we worry so much. You are aging and you are with HIV and you are now wondering, will I actually survive? Will I be the next one? So what we have done is to have an online support group for seeking services. So I would like to say that it hasn't been easy, and my thinking and my hope is in the fact that when I tested HIV positive and I talked to my dad in 97, he told me, "Don't worry, my daughter. By the time within a short while there will be medicine. You live to see the medicine," and indeed, I lived to see the medicine in 2003. So like all crises, we pray that we live through it. But all crises, people go. The HIV crisis was almost similar to this. But what have we learned? How have we learned from the HIV crisis? The role of community. How have we engaged communities? What has been the role of communities? Communities during HIV pandemic, that people coped, people accessed services, people were able to get food. And, until the antiretroviral treatment came. And so it is now. I always say, if I'm to live again, I would continue to give and give and give. So I implore all of us to continue to give the little that we have, to continue to talk to each other, to continue to strengthen each other. Because I do know God is watching and is our strength and refuge. But in the meantime, let us try to protect ourselves and ensure that we do not spread. If we are COVID test positive, let's protect ourselves, good care, and ensure that our loved ones are protected as well. But finally, I have one word. We need to organize our rage, and this is for our community as civil society advocates. We need to organize our rage. At a time when the president is blaming everyone for being infected, yet he has not signed the National Health Insurance Act, which was passed by Parliament. At a time when we are saying we need oxygen, and yet monies have been released and we are borrowing more and overburdening the country and citizens, we need to get more organized and organize our rage. And as long as we don't organize our rage and get angry, we are going to see money coming and going. Vaccinations will never be sufficient. So our take home tonight for me is that we need to be strong. We thank God for the lives of the people we have lost. We thank God for the lives that we still have, that we're able to breathe, and also try as much as possible to protect ourselves and our loved ones, but also get angry and ensure that we can try to challenge the existing status quo and ensure that the money works for us. So may the dead and the departed rest in evening. Thank you. Can you hear me?
Amen and amen. Sorry, my network is acting up. Hello, Flavia.
Okay.
We can hear you.
Yes, I'm done.
Thank you very much.
Thank you very much. And for me, I think we need to, organize our rage.
Thank you very much. And I'll reiterate what Flavia has said. Read out your message to everyone, and the rest of us can be able to read out your message of encouragement, call to action for everyone. And yes, Joshua, I see that you have joined us. We'll give you just a few minutes to share your experience. But if Joshua is just a few moments to share your experience. Okay, it seems network is becoming a challenge for every single person and every single one of us. But just to call on each and everyone in the words of Flavia, organize your rage. Organize your rage to speak to the challenges in the system. Organize your rage to see a change. Organize your rage to say enough is enough. More must be done, and just continue to push for things that even then, when we were losing our loved ones, if we couldn't change them, now is the time to rise up and change. At this juncture, I'll call upon anyone else that needs to speak or feels that they should speak to speak, but since Joshua has failed to come in, resident poet, Kunta, to just give us a little bit more of those profound messages in your poem. Just recite for us again, and then we shall have Alana to say something, and afterwards we shall close this memorial.
The tides have returned to the shores, bearing an audit of men and women who braved the rage of the seas. We call them health workers. They return dead with weight. Weight of sailors who journeyed into the unknown, rowing their bare hands for oars atop the sinking boat. They returned mothers, necks stiff, faces the color of nothingness, a memory of promises lost. Another day, another statistic. 2,000 bodies and still counting. We are running a race of numbers. The blaring sound of sirens is witness, and the media has become a graveyard and excesses. Healthcare providers reign auctioneer while the public healthcare system remains a malnourished child, cowering under the shadow of empty promises. But the head of the house has long been on vacation, and while away, visitors have pitched camp in his bedroom. They have taken to counting his wife's waist beads, and while at it, they have found a way of prematurely shoving whole foods down the throats of figures. Check in before you can be checked in. This, the new Hippocratic oath. The highest bidder gets the bed. "2,000 bodies and of numbers. The blaring sound of sirens is witness, and the media has become a graveyard, a piggy bank of government's excesses. Private healthcare providers reign auctioneer while the public healthcare system remains a malnourished child, cowering under the shadow of empty promises. Again we return to the heads of the house. Gasping for breath. Pallbearers bearing mothers, sons, daughters as postcards. With straightforward hands longing for answers, but all we get is a sneer. We are told and just like the previous harvest seasons, the public healthcare system chokes on crumbs, and with it, its dependence. But our voices can no longer be covered under muffled whispers of resignation of it is what it is. Because our grief hears no language of compromise. Our grief leaves us howling in empty hallways, dead in the night. Our grief knows that these lives could still be 2,000 bodies and tired of counting. Thank you very much.
Thank you, Brian. Indeed, we are 2,000 bodies and tired of counting. Alana, I will leave the floor to you.
Yes, thank you, Liz. Thank you so much, everyone, to sit here and take pause. I was worried that it's a Friday and would not be able to do so, but this was very important to us because we are living in a time like no other. And we hoped, we kept saying, maybe we'll do it when COVID ends, but it doesn't seem to end. So this is organized under the auspices of the Coalition on Quality Public Services, whose progressive vision based on human rights pushes for stronger public services like health and education for more equitable recovery. And we do all this because it can't be left to the arbitrary choices of government. We need to fight for a dignified life for all by reclaiming public services, and particularly by reminding our policymakers that you're not just talking about statistics or dry decisions you make in ballrooms. You're talking about our families, our brothers, our sisters. We're talking about a nation that is actually at risk right now, with no hope in sight unless they wake up. As many of you know, we have a manifesto, and I just wanted to quickly read it off as we close because I've had so much, almost every single person here has really talked about recentering what's important and talked about the need to reclaim public services. The manifesto, Enough is Enough, Reclaiming Public Services, a people's manifesto. Recognizing that quality public services, such as healthcare and education, are essential to realizing socioeconomic rights and protecting the right to life and other human rights, that they are key to ensuring equality and inclusion for all groups in society, that they play a key role in reducing inequality, including gender and income inequalities, in the sense that they ensure universal access, independent from economic or political status, that public services alleviate poverty and vulnerability and contribute to economic development, that improved social service delivery builds citizens' trust and fulfills a social contract between state and people, that quality public social services enable people to live in dignity and achieve better standards of living, recognizing that quality public social services are key to mitigating the proliferation of unregulated private actors that exist instead of public options, that public services are essential for all people, not only the poor or vulnerable groups, although these need it the most. We demand the following: that government must strengthen public social service delivery for all persons, regardless of social status, in line with international human rights law, making sure they're accessible, available, acceptable, and of the highest possible quality. And they're accountable and participatory and non-discriminatory. The government should robustly invest in public social services, which are the first point of call for the poor and most vulnerable. That it must remain in stewardship of the provision of quality public social services. That they must be financed through progressive taxation and curbing leakages like illicit financial flows, other forms of corruption, unjustified tax exemptions. That quality public health and education must be free at endpoint for user. That quality public social services must be delivered by governments, and the governments should ensure meaningful participation of the populace when designing and monitoring these public social services. That it should refrain from commercializing and privatizing essential public social services like health, water, electricity, education, including through public-private partnerships or commercial-private involvement in social service delivery. And it must devote the maximum available resources to ensure quality social public services. Public finances cannot fund for-profit engagement in public social service delivery. The government must put in place a strong regulatory framework for private actors in health, education, among other social services. We can't leave these social services to the whims of the market or the goodwill of government. They are fundamental human rights. So I hope that you will continue to engage with us and join with us. I know that many of you, whether you're activists or you're just regular Ugandans, what I heard overwhelmingly tonight was a call to action. And while there's not much that can comfort you when you've lost your family, I remember losing my mom at an early age, and literally there's nothing that could comfort me, nothing would bring her back. But I think the call to action is something you can control, something you can do, making sure that as the next wave comes, and it's already on the way, because I read that this was the worst week in Africa, and that there's another wave coming, and I felt I lost the will to leave. But that when the next wave comes, that we are demanding better, that we don't have to have these needless deaths. We increasingly urge that this is not just civil society that should be speaking. This is us as people, as citizens, saying we deserve better. And that message must continue to go out there. Thank you so much for sharing your stories. Keep sharing your stories. We will continue to support you, both from like an advocacy perspective and amplifying and litigation and all the work that comes with that. But we've also been thinking very intensely, as one of you, I think it was Arnold, who mentioned the need for grief, for something on grief and collective gathering, because in a moment like this, when you cannot gather, when you cannot bear witness, it becomes really, really hard. And so there are things that we are thinking through around mental health and grief. And also to urge that the ministry does have that hotline. I know that there are many things we have issues with them about, but I do commend them for that. And they'll be having also a session, I think, around counseling and the other providers, but we do recognize that that is an area that we need to really also make sure is amplified in these discussions. And it's just been so lovely to meet you. Thank you. I don't think I've been in a space that has been so candid and so open, that had my heart breaking. Thank you, Brian and Charles, for the really beautiful poems. And we hope we just continue to engage. For those who would like to be added to the listserv for the coalition, please let me know. I'm happy to add you. And like Flavia, I think especially mentioned, we must learn. We must really learn. We saw this with HIV. We are seeing it with COVID. Who knows what else is happening? And maybe that's where we channel our energy and all of the emotions that we have that really have nowhere to go. So thank you for coming tonight. Our time is spent, and again, in honor of those who are lost, I also lit a candle. Thank you.
Thank you very much, Alana, and thank you everyone else for coming. Thank you for sharing your stories. I see that Dennis is saying, please add me to the coalition, and he has shared his email. Everyone else, if you need to be added, just share your email and you'll be added to the list. So, otherwise, allow me to bring this memorial to an end. My condolences go out to each and every single person that has lost a loved one. May God strengthen you throughout this hard time, and may your loved ones' souls rest in peace. Feel free to leave at will, but we shall continue to engage. This is just the beginning. Good night.